So Section A tends to be the ones where there are very, very vague questions and you sort of have to come up with the medication yourself.
Mayo University Hospital has been great. You know, you've got a lot more kind of one-on-one teaching with consultants and better kind of availability then to go and see patients because you're not all competing for the same patients, so it's a big difference.
And the consultants are really helpful. They'll take any opportunity they can to kind of turn around and give you a lesson, you know, and I find you always remember more when someone is kind of teaching you on the spot. Almost you'll say, oh, I remember that day with that particular patient. They're very good.
It's all about just kind of putting yourself forward and not being afraid to just kind of get involved and just ask questions and very open and help you as much as you can.
It's very close to site, so they can pop across from work into the academy. It means that we have more medical students on the floor on an ongoing basis in the hospital. So again, that means that our clinicians are working at best practice on an ongoing basis. They again have to support an educational focus at all times. So it's a general sense of education that's around and that everybody kind of sees we're trying to function at the best possible level.
The experience that our medical students have here can influence them to come back here to us as junior doctors, and we're very aware of that, so we try to ensure that the students have a good experience and that they're well taught, and actually we like having them because education is obviously part of our responsibility anyway.
Rural hospitals, they are actually quite nice. You learn more than in a major hospital. Major hospitals you will see more, you see the more advanced cases, but certainly in the rural areas there's quite a lot as well, and you get to learn a lot more compared to in the bigger hospitals where there are more people, so unfortunately the more interesting things will be dealt with by the more senior members of staff.
I'm from Malaysia. I came over to Ireland for college and I applied for West Coast Ireland for my internship. I was in Dublin for 6-7 years and it was very hectic, and the environment there is very different from here. It's a lot more pleasant here. And I enjoy working here.
This is very important. We enjoy the junior doctors and students who come here. So they're like a breath of fresh air, and they keep us going. So we enjoy every bit of it.
Because it's such a close-knit community, you get to know all of the doctors, obviously, but then also the adjunct staff as well. Nurses, physiotherapists, secretaries. Basically, you get onto a first-name basis with everyone, and it becomes a lot easier to get things done because we all know each other.
It's great for when you decide to apply as a SHO. The opportunities here to make an amazing impression is all there.